Put yourself in a position, you touch a doorknob, and then you get a sudden feeling of touching it again, so you touch. But after that, you still get the feeling of touching it yet again, so you touch it again for some reason. And after that touch, one more time, and one more because it was not equal. OCD, as known as obsessive compulsive disorder, is an anxiety disorder, even called disability, that pretty much makes you repeat things which you don't want to repeat at all. From washing your hands to touching the doorknob, the feeling of repetition only goes away after actually doing it, and guess what? It comes back again, and the cycle repeats until it fades away naturally, and then goes back again. OCD affects men, women, children of all races, ethnicities, and socioeconomic backgrounds equally. In the United States alone, about 1 in 30 adults and 1 in 100 children have OCD. Also, according to World Health Organization, OCD is one of top 20 causes of illness-related disabilities worldwide. It's not known what causes OCD, but family history, stressful situations, and chemical imbalances in the brain are thought to contribute to the development of the illness. The main symptoms of OCD are two. Either it's obsessive thoughts, as example, fear of germs, ordering symmetry like putting things in a lineup of just right, and the second one is compulsions, like excessive double checking of things, spending a lot of time washing, cleaning, counting, tapping, you name it, and repeating certain words. In severe cases of OCD, in people who did not respond to medical and behavioral therapy, psychosurgery, aka deep brain stimulation, may be performed. It's done by simply inserting a couple of electrodes inside the needed parts of a brain, and then the electrodes get a small current to pass through them, which causes a brief seizure to the patient. At least it helps over 30% people who get it done. Yup. OCD simply cannot be prevented. Only early diagnosis and treatment can help reduce the time a person spends suffering from the condition. If OCD is not treated, the symptoms may vary for years. They may go away, remain, or simply get worse by adding other disorders to it, such as depression. From the 14th to the 16th century in Europe, it was believed that people who had sexual, blasphemous, or other obsessive thoughts, as known as OCD, were possessed by the devil itself. Based on the reasoning, treatment usually involved banishing the evil from the possessed, simply throughout exorcism. The reason why people with OCD respond to the obsessive thoughts with compulsions is simply because they feel like they must do it. If they won't, they start having bad thoughts like death to themselves or somebody else, bad fate, or just harm. There is no laboratory test that can identify OCD. Mental health professionals use diagnostic interviews to determine the presence of OCD, as well as the level of it using Yale-Brown Obsessive Compulsive Scale. OCD is often mistaken with simple things like addictions, such as gambling and even overeating. The difference between them are that people who have OCD never enjoy the habit of having and responding to it, while gambling, or in short, addictions, give pleasure for the user. OCD compulsions can be extremely time-consuming. Sometimes it may be just checking the clock for a minute, but in some cases, it proceeds for over an hour. Now put that to perspective. You check the clock, rotating your head back and forth, over and over and over again, until you feel a click that it's enough. And who knows, cycle may come back again with a different or the same compulsion. Thank you everybody for watching this Woe 12 episode about the creepy land of OCD. Not as horrible as sleep paralysis, but still, goddamn, OCD is a pretty horrible disease and I know that. Anyways, don't forget to subscribe and do all that jiggle I guess as always. And I guess I'll see you next time then.